stories that client tells us as an expression of their inner world, the narrative approach thinks about the telling of the stories as a means of constructing and shaping the reality and the identity of people. So the stories people tell us are not reflection of their either identity, self, personality, you name it, but rather they build and construct their identities. So the stories we tell ourselves about ourselves shape who we are. You can think now about yourself, right? About one dominant story that you have about yourself. And think how it shapes your life, how it invites you to be in the world, to think about yourself, about other people. A few months ago, I worked with a family of a 15-year-old adolescent girl. And the family and the girl were dealing with a very difficult incident in which sexually explicit photos of this young girl were circulated on social media, especially of kids in her school. So when the family entered the room, this girl, she came in with and immediately started to tell the story about her that says things like, I'm weak, I'm spineless. Okay, these were the words she was using relating to her part of allowing her boyfriend take these photos. And actually that was very much the first thing she told about herself. Think about this story for a minute, okay? This story is like a total narrow label of a person. And through this label, it is actually the prism of how, you know, we see events or moments in our life. But, you know, there are also a lot of things or happenings in the life that are not related to this very thin story. But once we come with this thin story of I'm weak or I'm spineless, then more and more events or happenings in their lives can be related to these stories and are attached to it. So the story thickens and thickens and thickens. And this story doesn't exist in a vacuum, right? It intensifies through the eyes of others. Think about her parents or her peer group. And therefore, this story feels as if this is the true story, the true, you know, actually that it represents the identity of this girl. But there are, of course, other experience that this very same girl has a spine. You know, I saw her in the room. She's not spineless. She has a presence. She knows what she wants. She knows how to stand up for herself. But in the face of this dominant story of being spineless, such stories don't have room, right? They are transparent. And as narrative therapists, we believe that there are always more and more stories. People are multi-story. And the narrative approach think about personal and family stories as inherent, created, and nourished by social discourses and by contexts. This is very much, you know, social work perspective, right? So it is impossible to think about the girl's story without addressing the societal context of gender, for example. Those discourses and norms, what is expected for women, of women and men, including sexuality, sexism, body image. So in therapy, we want to look at these societal discourses as well. And deconstructing these dominant stories like being I'm spineless, understanding how these stories were constructed in the life, how it came into life, what additional people were involved in the construction of these stories, and of course the social context that I talked about, this process actually raises new possibilities for life. It opened possibilities for beginning the discovery of more alternative stories or preferred stories, as we would call it in narrative therapy. And with this girl, for example, we discovered little stories of her being, for example, connected to herself. She knew exactly how she wants these incidents to be handled. And she further developed this story in therapy. These preferred stories are related to people's values, to their moral principles, their hopes, their dream, and they are, of course, in relation to other people. So if we are talking about personal and family stories being constructed in a social context and social discourse or discourses, let's think about the trauma discourse that we are all immersed with. Okay, the social discourse about trauma, the professional discourse about trauma. So these are images that came up when I Googled children and trauma. These are like the top Google search. Let's think about the victimhood discourse related to trauma. It's very prevalent, I think, in the photos. This discourse actually raises a lot of empathy to victims, and rightly so, for children who experience trauma, abuse, maltreatment. But it is a discourse that relies on vulnerability and on a deficit perspective. And many, many times implies that children or young people dealing with trauma are incapable of affecting or managing their lives. This discourse may contribute to reinforcing a dominant, narrow story of identity of a child or the family, being very weak, deficit, hopeless. And the social and professional ideas about among therapists, education, the education system, medical staff, and so on, might contribute to this helplessness, becoming the dominant story of a child's life. And by that, their sense of agency might be diminished or denied. So in contrast to this experience of deficit, victimhood, and vulnerability, I want to talk about the concept of personal agency. So personal agency is a sense of self which is related to the experience that a person is able to somehow influence, lead, or navigate his or her life according to his or her intentions and values. I like the metaphor of driving one's car's life, okay? As if we are, I guess you all know this experience, right? You sit on the driver's seat and you know where you're going. Maybe you'll need to change the way because the road is blocked, and maybe you'll use your GPS navigation to get there, but you know where you're going to, okay? So this, I think it's a good metaphor for me for personal or self-agency. And developing a sense of agency is central to our work with people who are dealing with the consequences of trauma in their life, because it may be a kind of an antidote to those stories with negative conclusion that people tend to tell about themselves, to themselves, about their identities. Michael White said that in his work with people dealing with trauma, and especially with children, that he always starts from this point of attempting to restore their sense of self, their agency. And to do this, we must discover with the people we work with collaboratively what they give value to in their life, what is precious to them, what is important to them, what they value. So now let's move to a different territory of identity, and let's talk about values. I would like to ask each one of you to write in the chat, and maybe Avital, you'll be willing to read this out. Think about one cherished value or commitment in your life that you hold close to your heart. It can be a value that, you know, supported your decision to enter the field that you work in. For example, in my experience, it has to do with empathy, with compassion, determination, and so on. So think about yourself, about one value that is close to your heart, and please just type the value in the chat. Avital, can you read some of the values that are there?
Sure. So we have honesty, consistency, respect, kindness, equity, care, cause no harm, humble service, genuineness, empathy, hope, respect, loyalty, compassion.
Beautiful, hope, beautiful.
Curiosity.
Okay. Now, I would like to ask you, that's a bit harder. To travel back in time as far as necessary and to find the earliest possible expression of this very same value that you thought about. How old were you? What was the first hint or clue of this value or commitment? So if you can write in the chat the age of this first situation in which the value was expressed in your life. Either the value was expressed verbally, or was it expressed by a behavior or a thought that you had in mind? Avital, what ages do we have there?
So we have 5 people already who have written 8.
Wow.
Then we have 12. We have 10. We have 5.
Wow.
Kindergarten, 10, 14, approximately age 5, 6, early childhood when starting school. Age 10.
And you know what's so fascinating about it? That as people go and their memory kind of wakens up, they will discover earlier and earlier experiences in their histories of values, of a specific value that was expressed in their life. So from your experiences and also from the stories that we know from that we encounter in the therapy room, it is evident that children, even very, very young children, are guided by clear moral values and principles. Children have knowledge about what is important to them, what is valuable to them, what is valued by them. And they have knowledge, skills, expertise, and unfortunately, these oftentimes are not heard enough in therapy settings, especially with children dealing with trauma, abuse, neglect. And as therapists, you know, we're all social workers, educators, we're all trained, and we feel very comfortable to talk about problems and hardships, to listen to traumatic stories. But many times we leave the child's skills, knowledge, values, and agency out. And we want to give more space to discover what children hold closed to their hearts in their own lives. And keep in mind the different power differentials within the therapy setting. The hierarchy within the family. So children's voices are often not heard enough in family therapy, for example, or the immense power of therapists and social workers when it comes to talking to children. What are we focused on in the interview? We definitely want to be more reflective and attuned to issues of power and sensitive to hear children's voice. And this is a beautiful and very practical book, focuses exactly on that, how to give voice to children in therapy, especially through play and imagination. So I assume there is a consensus about the importance of telling stories of trauma and about telling them or talking about them in a protected environment as part of the process of processing traumatic experiences and traumatic memory in the journey to recovery. This is no new. It traces back to the first works on trauma and recovery like Herman and others, even though I have to say that in a cross-cultural perspective, this issue might be questioned, okay? This is a very Western idea to speak about our traumas in front of other people, but this is a topic for a different talk, which I'm very passionate about, but it's not for today. So the issue of witnessing traumatic stories is extremely important. That either the therapist or the social worker witnesses the story of trauma, the family or family members witness traumatic story, and also community members, especially in cases of child sexual abuse, in which the trauma usually occurred with no external witnesses, right? So the abuser usually denies, the family often doesn't see or doesn't want to see, the society as a whole turns to shift the gaze from the phenomenon of child sexual abuse. So it's really important to, I think my point is that it's really important to talk about trauma, to tell stories of trauma, especially childhood traumas. But the telling of the trauma is dangerous because it has the potential of reliving the trauma and re-traumatizing, especially young children and adolescents. So how do we talk about trauma? I want to give the metaphor of a river. It's not my metaphor. The river is a metaphor for the dangerous potential of reliving the trauma and re-traumatization when telling the stories of trauma. So talking about trauma sometimes feels like being in a raging river. The trauma floods, the trauma takes over. The trauma, in narrative terms, the trauma is the only story that can be told. And as part of the effect of the trauma, people tend to talk about the trauma from the river, as if they are now in the river struggling. We all know, I guess, this experience when we work with people who talk about traumatic experience, maybe from our lives, and they actually experiencing again in the here and now, the visions, the sounds, the smells from the original trauma that is reenacted. So how can we ensure that children are not re-traumatized when talking about past events? The goal is to help children locate or anchor themselves in a preferred alternative territory of their identity, what we would call the river bank. So how to move from the river to the river bank. Michael White called this process repositioning. So the metaphor is to stand on the safe bank of the river, to view the dangerous river from afar. So to talk about the trauma, not from being in the trauma. This metaphor helps me to distinguish between these two ways of speaking about trauma. It's not for today, but this idea of looking about something from the outside is related to the practice of externalizing conversations, which is a very known practice in narrative therapy that aspires to see problems as separate from people. So what do we have on the riverbank? So the children's values, right? The same values that you talked about earlier in your life, in your childhood. How can we help children connect to their own values, their hopes, their dreams, what they intend for in their lives, their purposes, important people in the child's life, their skills and knowledge of the child. Very important how they responded to the trauma, their skills and knowledge that expressed in their responses to the trauma, and of course, their personal, their personal agency. So if we talked about earlier about this multiplicity of stories in our life, so this is also the case when dealing with trauma. When we think about a multiplicity of stories regarding trauma, we can think of at least 2 stories. And as therapists or social workers or educators, we want to develop the skills of listening to these 2 stories. There might be more, but let's start with 2, okay? Michael White called it double listening. To listen to simultaneously to the stories of trauma, the effect of the trauma on the child and the family, but at the same time, to listen to stories of coping and resistance, survival, resilience, and so on. And children always take steps in order to reduce the effect of the trauma they are going through or have been through, and they try to preserve their values, what they hold precious in their life. No one is a passive recipient of trauma. No one is a passive recipient of trauma. Children, even at a very young age, they have skills developed, often in partnership with others, with siblings, with parents, with pets, with imaginary friends, they have skills they develop to deal with the traumatic experiences and their consequences. And this story of coping and responses is often hidden. Michael White called it the subordinate story. So listening and shedding light on this story emphasizes the fact that the trauma story doesn't represent the whole identity of a child. So it's, for me, it's an ethical stance to listen to both stories, and a political stance, if you want. So Angel Yuan from the Narrative Therapy Center in Toronto, she sees working with children who have been through traumatic events as a therapeutic project of searching for and collecting responses to trauma. Responses to trauma. Sometimes as therapists, we hear them spontaneously, if we listen carefully enough, but sometimes we need to ask about them directly. So here are some questions that she has developed to ask children about their responses to traumatic event. And she's specifically speaks about child abuse. So how did you respond? What did you do? What did you do when you were scared? What did you show or not show on your face during times of abuse? Where did you hide when you were scared? What did you do once you found a place to hide? Even though it was not possible for you to stop the violence as a child, how did you attempt to protect yourself or others? And so on, okay? So a 6-year-old boy, for example, said that at times of domestic violence, he would teach his 2-year-old brother to count from 1 to 10, or a little boy who brings tissues to his brothers who cries after being subjected to violence. Sometimes children report that they have developed ways not to show distress, anger, fear, sadness, in order to reduce the severity of the abuse. Or even, we all know dissociation responses, right? And these can be understood as a way for children to protect themselves from abuse, sexual abuse especially. So the ways in which people, children, respond to trauma are based on what they give value to. Think about this child that gives a tissue to his brothers, okay? So what is the value that underlines this behavior? And this is something that in narrative therapy, we would like to be very attentive and explore. Another illustration would be the work of David Denborough from the Dalwich Center in Australia. And he developed a checklist of psychological and social resistance. It was around his work with collective traumas in different places in the world, including Israel and Palestine. So human rights organizations interview people who have gone through atrocities, and they want to document these experiences to give survivors voice and also to have evidences of the atrocities. And so mainly, they usually come and interview people about their traumatic experiences, right? So David Denborough developed additional ways to document and give voice not only to the traumatic experiences, but also to the ways in which individuals and communities responded to trauma. So in this tool, you see only just a small part of it was designed to assist practitioners in shaping this double story conversation with people who experience trauma. So you can see on the slide some questions that we can ask people when we interview them. That you try to protect yourself during the traumatic event, either physically or emotionally. So was it only one time, more than one time, or many times? Display acts of caring for others, receive comfort from others, display acts of caring for themselves or oneself during the traumatic event, found ways to encourage others, to stay connected with others. And later on, these checklists were also adopted to therapeutic work. So the idea here is not to use these tools as an assessment tool, but rather as a conversational guide to encourage us practitioners to elicit and cherish the knowledge and skills of social and psychological resistance to traumatic events. And it can be used with communities, with groups, with families, with individuals who experience trauma. And this approach actually gives a great significance to seeing people as part of their communities, as families, communities, and their cultural heritage and traditions of coping. So now I would like to move to our last part. And I will present one very practical tool, the Tree of Life, for working with children and families who experience trauma or other hardships that can be applied in different settings. So the Tree of Life was developed by Natsalo Natsube. She's a psychologist who worked with orphans and vulnerable children in South Africa. Many of these children, their relatives died of HIV/AIDS. And in her work, she felt that the ways she and her team tried to speak with the children about their losses, the children either refused to cooperate with them, or they have like really severe reactions or negative reactions. I assume some of you who work with children in the field of trauma knows this experience, right? And the workers also felt incompetent. They experienced fatigue and burnout. So they realized that their ideas about emotional ventilations of feeling and telling the stories of trauma as is were actually harmful for children in this context. And she started to develop a very creative and beautiful tool based on the idea that I talked about before, the safe place to stand, or the river bank. You can find more about this tool in the website, that you can see the link, and in a very active Facebook group, collecting more and more experiences of professionals who use it in different contexts around the world. And the Tree of Life was later applied with children all over the world, in refugee camps, in communities suffered natural disasters, with group of children who experience abuse or neglect in their families. In Israel, the Barkai Institute did a beautiful work with children in an area in the southern region of Israel that suffered prolonged missiles attacks from Gaza Strip. And what is beautiful about this tool, that it's very flexible. So it can be applied to working with children in different ages, in individual therapy, family therapy, group work, community work, educational setting, you name it. And it can be utilized in one session or one meeting with a child or a family, or as part of a very long process, therapeutic or educational process, you name it, okay? So it's for you and for your creativity to take it whenever you feel like. I personally have used it mostly in family therapy. So either each family member created their own tree, or we created one family tree for the family. And I also have used it with in group work with children and with professionals. Okay, long introduction. So it aims actually to establish this river bank that we talked about before for children, before talking about the trauma, to listen to this double story, the story of trauma and the story of coping, and to discover the child or the family's values. It also allows children to contribute to the life of others, especially if it's done in a group. And the metaphor of a tree evokes in each one of us different memories. It's a strong metaphor. When you start working with it, think about yourself, okay? What evokes in you when you think about trees in your life? What associations comes to mind? You can see on the slide a photo of a very old olive tree. This olive tree is from the village where I grew up in northern Israel in the Galilee. And my parents have an olive orchard, and trees are very much connected to my childhood. So trees carries a lot of meaning and memories across cultures and across contexts. So it's a good metaphor to work with. So we start with drawing the framework of the tree. It can be done on a small paper, as you can see on the left side, or on a large one on the right side. And then the first stage of the process, in this stage, we guide the child or the children, if it's done in a group, or the family, to go through each part of the tree and try to write or draw or visualize the following elements. So if I had time, I would do it with you. So in the ground, we ask children about the place where they live, what they do each day, what they enjoy doing. So we start with the very daily concrete activities. We move to the trunk. What do children care about? What are we good at? So we move to the values and the skills, right? The branches represent the goals, the dreams, the wishes. So it's about the intentions and the agency of the child. The leaves represent people who are special or important to us. So it's about relationships, and love. And it can be people who are alive or dead. The fruits represent those special people, what those special people gave us. So it can be concrete gifts, but also legacies, ideas, skills. The flowers represent what people can learn from us. So it again goes to what the kids are good at, their skills, their abilities, and the roots represent where we come from. So it's about our rich heritage, legacies. It can be nuclear, extended family, community. And so it's clear that this entire part is about repositioning, right? It's about positioning the child in the river bank of his life or her life, in the preferred territories and identities. And this part can take 30 minutes, or it can take 7 therapy sessions. Each one of them is dedicated to explore, deeply explore one of these elements. The next stage is the forest of life. So if it's done in a group or in family, with family, so it can be done. If it's done in individual therapy, then you skip this stage. And in this stage, children are asked to hang their trees on the wall, and there we get a whole forest of the trees of everyone. The children then are invited to share with their colleague, with their peer group, the richness of their lives, their dreams, their skills. And the children are given also the opportunity to relate to the skill and abilities that they see in their peers and to write responses. It can be done on notes or memos that can be pasted on the various trees. The third part is the storms of life. So here we go, and we want to invite children to start speaking about their hardships and traumas and challenges in their life. So here again, children are invited to talk both about the hardships and to address ways of coping. So we are trying to assist again to narrate a double story. We talk with children about their problems and about their skills and way of dealing with their problems. And again, this can be done in a group or in personal, individual therapy and so on. And it can take one session or many sessions or up to you. And the last part, and this is where I'm gonna end, it's about celebrating life. Oops, sorry. Yeah, so now you're gonna see again the whole slides. Okay, so the last part, it's about acknowledging and celebrating the skills, the hope, the knowledge of children. So it's kind of a celebration, right? So we can prepare certificates for the children. Of course, a specific certificate for each child that indicates his or her strengths, hopes, special people in their life, anything else positive that the child has identified for himself during this process. Okay, there are many other ways that we can do it. If anyone is interested, I'm happy to give you some more materials and papers about it. There are a lot of creative ways to do it. So I think I'll end now, and I'll happy to hear questions or comment. And mostly I'm very curious to hear where this work resonates with your work, with your context, other things that you have already done or things that you may do in your work. So thank you.
Thank you so much, Yochai. It was really inspiring for me to hear you. And I already have a few things that I can say about how it resonates with me, but I'll try to keep quiet and first let our participants go ahead, and whether you'd like to write it in the chat or unmute yourself and say something, we'd like to hear your thoughts and questions at this part.
That's a beautiful idea, I think. Actually, one of my experiences a very good experience was, I think it was a 5 days or maybe longer workshop with social workers who work in the field of trauma. And we did a tree of life with the social workers about their experiences working in the field of trauma. So it was so meaningful for them, right? To find, first of all, their ground, their roots, their agency, their values about their work, about why they're doing it, but also to share, their hardships and to be able to witness each other's hardships and even trauma, secondary trauma, from the work. So I think this could be beautiful. I don't know, I've never did a tree of life online on Zoom, but I'm sure that if you're going log into this Facebook group that I mentioned, there are people who already did it. So you can get some ideas from there.
And another comment we have is, it is really great and can be utilized in many ways.
Thank you.
Also, would love to hear more about the third level of the storm to work with young children.
Yeah. So with young children, we would start speaking more, I don't have the English word now, Vital, help me, hashlacha, projection, right? So we would start speaking about hardships in the lives of trees. So how do trees cope with hardships? If there is a storm, if there is snow like you guys have now, if there is not enough water, if there are bad people who come to the forest, how do trees cope with? So we can start speaking about it differently, not directly, but more in a projective way, right? And we would it's hard to give recipes. It always depends on the age and the specific circumstances, and if it's family therapy or individual therapy. But the idea is to allow children to speak about what they've gone through in a protected way, in a way that we witness it and that we focus also about their coping, what they did, that they were not passive, and so on. I hope it helps.
I wanted, Yochai, if you could refer to some differences from your viewpoint between collective traumas, which I can imagine are somewhat, I don't want to say easier to work in a group, but would make a lot of sense to work about it together in a group. So like children who have gone through a hurricane, who have all experienced some kind of natural disaster. And comparing that to a situation where there's more of personal traumas, where not necessarily collective ones.
Yeah. So in my eyes, I would feel more comfortable doing it in a group setting if we're talking about collective trauma, and I will be more reluctant of using a group work if we're talking about personal traumas. There are people who did the Tree of Life in a group for children who were abused in their families, in different families. I personally don't feel comfortable doing it. I would either do it in a personal, like one-on-one individual therapy with the child, or preferably, if it's possible, and there are family members who are willing to take part, I would do it in a family context. But definitely, if we're speaking about collective trauma, the collective aspect of resilience and of collective self-agency, let's call it, it's very powerful if we do it in a group.
Okay, thank you. I think that was an important clarification, and definitely with children going through COVID right now in all different countries,
right.
I think we could definitely refer to that as a collective trauma for for them and something, this is maybe a tool to work with them. There was a question in the chat. So Benny wrote, if I understood correctly, the Tree of Life is aimed at enhancing children's self-perspective as positive agents. Can it minimize PTSD without them retelling the trauma?
Okay, so here we comes to, to different, I would say, theoretical perspectives. PTSD is one more, I would say, medical perspective to think about trauma and its symptoms. And in narrative therapy, we turn to think about it differently. So I would like, if I'm trying to integrate both approaches, I would say that in my experience, once we assist children locate themselves, and it's not a one-time job, right? It's like a thing that we need to do again and again and again when we meet with children who have gone through trauma, right? But once we help children, sometimes it doesn't work, okay? It's not an easy task. But once we help children to locate themselves at the riverbank, then the retelling of the trauma would be different, would be from a different territory of their identity. So it would not be, hopefully, would not be re-traumatizing and will help to reduce what you might call PTSD symptoms. I hope I answered the question.
I think you did, to the best of your abilities and the limited time frame we have right now, and considering, yeah, Benny wrote you did. So we have another question in the chat. Have you ever had an adverse effect when assessing the child's protective techniques?
Say it again, please.
Have you ever had an adverse effect when assessing the child's protective techniques?
No, but I did have experiences when children didn't want to cooperate, okay? Or families didn't want to cooperate with that. So, we try different things. It's not always, it doesn't work all the time, but we can try. But sometimes there are children who don't want to do it. Sometimes they might say it's stupid, I don't want to paint, I don't want to draw, I don't want this. Okay, fair enough. we can try, we can offer, but we can also we can also use the Tree of Life as a metaphor for ourselves. I think for me, this is like most important than actually doing it with children. I think for us, it can be a metaphor or an image, how we want to locate children we're talking about trauma. We can do it with the Tree of Life or without the Tree of Life. We can speak with children about what is important to them in their life before start speaking about the trauma, what they like to do, what they're good at, who are their friends, what are their values in different words, of course, and so on. And after we feel they are in a different territory, then we can start asking children about traumatic stories that they've gone through. So the Tree of Life is one way of doing it, but I think it's about how we position ourselves as therapists or social workers or educators when encountering children or families who experience trauma.
Thank you, Yochy. I think that's such an important point. Yes, we have a participant, sorry.
I think I was the one that asked, and I think that you're wonderful, by the way. But what I more so meant was, I wanted to kind of like utilize this, but I'm thinking back on some experiences when you've asked them specifically with the resilience part. What did you do to, not that you could have contributed to the violence, but what did you do to protect yourself or someone else? What if they feel, what if they feel shame because they feel like they can't think of something that they did to protect themselves?
Okay, thank you for the question. So So what we are trying to do is I wouldn't ask these questions as such. Again, it was a demonstration. What I talked about with double listening, so I would carefully listen to what children tell. And sometimes we call it in narrative therapy, unique outcomes. So it's like something that you can hear a tiny bit of something that a child did. I can tell you a very short story of a client of mine. She was sexually abused when she was 15, I think. And I saw her as an adult. And she told me that the story of being sexually abused. In her eyes, back then it was not sexual abuse. It was a relationship with a person who was in his 40s, and he was a teacher in her school. And, you know, so, but when she told me the story, she did with, I don't know if you can see it, the story was that they were in his car, and he tried to kiss her and touch her. And she did this movement with her hand. And I stopped her and I asked her, can you tell me a little bit about this movement that you just did with your hand? And then she said, yes, I tried to open the door of the car. So I asked her why. She said, of course, I wanted to go out. And then I started, we don't have time, but then I started to ask more and more about this wish of going out. And why did you want to go out? What was important to you then? So it was this, and then from there, we were able to start and see a different story of her actions in trying to not be passive. The story, the verbal story, was about, I was passive, I was there, even I was part of it, I wanted it. And when we started to go deeper from this very tiny hand movement, we were able to explore. So this double listening is not about asking a child, what did you do to protect yourself? Because this is a risky question. You're very much right. I didn't do anything. And then the dominant problematic story thickens. So we would like to very carefully look for those hints and try to expand them, or at least to explore them a bit further. So I hope it clarified.
Yes, that was a very important clarification. So Yochai, I'd like to thank you so much for joining us this morning. And you know, this is such a difficult topic. We do have people right now in the chat saying how helpful and inspirational this was for them. And that's a tough thing to do in 50 minutes or 60 even. So thank you so much. Great to see also Jill and Dr. Brand and so many friends of Haruv who are here with us on this call. It's great to always see you. For me, researching resilience of children who have undergone child abuse and neglect, this talk was really inspiring as to the option of not dichotomizing always the trauma and resilience on the other side, but having a way to bring it together and actually look at both sides of the equation. So there's lots of people saying thank you for the wonderful and awesome material. Yochai, if we'll have your permission, we can later on send the slides to the participants.
Sure. Yes.
Thank
you so much, everyone. Enjoy the snow in Tulsa. And thank you, Avital, for the invitation.
Okay. Thank you, everybody. We'll be happy to see you at more Haruv activities through our website or like us through Facebook, and we'll be happy to see you again. Bye, everybody.